And I wasn't kidding. Okay, now time for some quality caffeine intake. Now, so now I think you got an idea. When I say high, I'm not talking about dopamine releases, because I ain't hardly got no dopamine receptors left, and the ones that are left, the transmitters on the other end, again, because of all this anxiety and all that child abuse, barely work. And when they do work, it's not a good thing. I don't enjoy dopamine rushes almost as much as I don't enjoy the adrenaline rushes. The difference is, sometimes I can have 20, 50 adrenaline rushes a day or even in an evening. I don't even remember having 50 dopamine rushes in my entire life. I can remember about maybe 2 or 3 of them specifically. Recently, and when I say recently, I'm talking about the last year or 2. Yeah, a lot of people get dopamine releases a few times a day, I imagine, or more. I'm just guessing here because, again, I never knew what everybody else gets to feel, so I'm just having to make these things up out of an imaginary, physics-based mind. So, and the problem with the dopamine releases, again, they're very unpleasant because they're so unsettling. I probably didn't even know what they were a long time ago, and that's what, and again, was so afraid of them, especially because I didn't know what the fuck was going on when I get dopamine once in a while. Because again, I will admit that they do happen at positive high times like they're supposed to. Now, let's get back into explaining the quirks in this, okay? Now, the few dopamine releases I've had in the last couple of years that I remember, and again, it's hard not to remember them because it's so, I want to say almost like an amusement park right out of nowhere. Sitting on the couch and I get dopamine release and I'm just like, start shaking and I feel, my mind like exploding, and I literally just have to be like, especially if I'm around other people, I just have to be like, act normal, Joshua. Act normal, Joshua. Act normal, Joshua. Act normal, Joshua. You're acting a little too happy. Act normal, and I have to keep saying this shit in the back of my mind, and so the other people don't realize that I just got dopamine release, and I'm not, my body and mind is not. It's an outrageous experience, and they don't realize that. And the sad thing is, did you hear what the trigger is? Good, positive things, particularly social events. They give me the dopamine high once in a while, but the dopamine high is so odd and eccentric and outrageous because of my inability to experience it throughout life. I don't like it, so that motivates me subconsciously and consciously to avoid getting too happy, getting too high. So I wouldn't call it manic depression. I would call it like trying to consciously maintain a balance, even if I have to pretend, just to make you guys comfortable, just so you don't start freaking out, because I start freaking out from the dopamine that I don't never get and I don't expect. So that's one interesting situation. Now let's move on to getting high the other night. And when I say high, I ain't talking about smoking weed or well, what else do you guys do to get high? Because again, weed doesn't really even get me high anymore. I can feel it, relaxing my body. I can feel it easing the tension in my mind. But it's not that euphoric high. I used to actually get that a long time ago on the pot, on the marijuana, back in my, in my 20s. And that was kind of the whole idea of smoking it back then, was to get high, was to feel different than I did all day while I was working and worrying about performing perfectly for my paycheck, my tiny ass little fucking paycheck. Oh, God. Alright. Shit, I think I slipped there. Okay. Working for the paycheck, which wasn't very big. And that's really what got me smoking pot, was coping with the intensity of always trying to perform perfectly. It got so bad, my nocturnal seizures I didn't even know I was having, because the literature out there is not good enough, and it appears to be an intentional situation or system or something designed to prevent it, to prevent you from being able to readily learn these things. It is what it is, folks. Like I said, it took me 15 years to figure out what I believe I can easily explain in closer to 1.5 hours to no more than 15 hours. And if you need to take your time, take 15 days or 15 weeks. But I bet you I can do it. And you will be able to put it together 10 times easier and quicker, and even teach it 10 times quicker and easier than I can once I get all my ducks in a row, and get my quote book or course published. And that's my point. I can't imagine I'm the first and only person to do what I'm doing. If I was, why did the DSM 1, 2, 3, 4, and 5 come out, and then come out with new editions? But the last edition, it really dropped the ball. And again, I really do believe it is intentional. I went ahead and did some backtracking into history. Like I said, since the 1800s, they had started getting these ideas, generalizations of these systems in your head that I've been working out for the last 15 years. Doing this since the 1800s. But in the 1960s, they started a war on drugs. They started regulating medication because they realized, they just came out with these new antipsychotics and these new anti-anxiety medications. Oh shit. They're gonna fix a lot of people's problems, and they're gonna be productive, and they're gonna want answers for what happened to them. Well, that's okay. The Substance Abuse Act, they get it without a doctor's permission, it's a felony, and if the doctor gives them too many of them, that's a felony. And you know what? The one that works the best for the child abuse symptoms, let's make sure that they gotta have $10,000. They gotta be able to put up with the seizures for 10 weeks without any other medications. They gotta relocate in the worst time and place imaginable, which is even makes their anxiety situations even worse, which makes their seizures even worse, which is perfect because we want to fucking make this person miserable. And then you gotta pay a fucking almost year's worth of income for this test. Then come back and try all over again to get the prescription without discrimination, prejudice, or stigma. I could just go to a drug dealer, but that's outrageous. From what I understand, I could understand on the black market $2 a pill, possibly even $3 a pill. That's still only $60 to $90 for me to get one dose of medication a day. I won't even need that, I don't believe. But the prices seem to be closer to like $10 a pill. Just because they can. Because you can't go to the store and buy it. And if you do become addicted or you're mentally ill, you're going to go in debt. You're going to try to steal and do everything you can to keep your next hit. These drug dealers know it. They're going to rack up that bill, and then they're going to come get you. Make you pay if you can't keep up. I have not really ever slipped into that. I've always been like, if I can't afford it, I gotta suffer. But that was then. This is now. Now I'm like, technically I could afford it, but it's a policy. I don't ever want to have somebody call an ambulance and they do a drug test and are like, oh look, he had benzodiazepine in his system. He's an addict. We're not giving him treatment, or we're going to treat him worse because of it. And I'll be like, to be honest with you, that benzodiazepine very likely could have prevented me from coming to the, had a good chance of preventing me from coming to the hospital in the first place. 2 is correctly treating my problems correctly, and and 3, above all else, it's not the reason I fell out and came to the hospital. Like I said, 9 out of 10 says it would actually improve my chances of not doing it. The doctor's going to be like, Malinger, you're just trying to get more drugs. You're going to hospital jail. Oh. And then I talked to a real psychiatrist and they're like, whoop. Oh, shit. I'm getting you out of here, right? Get your shit ready. You're out of here in a couple of hours. When they realize I'm right on my fucking game, and I've fucking been through it, and I know exactly what the fuck is going on. And that light goes on in their head. They're like, whoop, get out of here, get your stuff ready. You're going out of here in a couple hours. Yeah, but I ain't even hardly been here today. It's 72-hour minimum in lockdown. They're like, and just, they don't say it, but I'm almost positive they're thinking, yeah, but the person who Baker acted you could get in real big trouble should you choose to pursue why he Baker acted you in court. And that's why they do that. They're hoping that they let me out, and because they gave me some grace, I'll give them some grace. Only because the last 2 times I seen a psychiatrist, I was able to get the head to snap back into, moral morality. That's a good one, moral morality. And like I said, you see, it happens almost conclusively now. Why? Why does now I never spend hardly a day in a mental hospital when I would spend no less than 72 hours, sometimes a week or 2? Why? What's the difference between now and then? Knowledge and experience. That's it. Had I had this knowledge 15 years ago, I'd have 15 years of experience dealing with this in a knowledgeable manner. I've actually got closer to 15 months, maybe 2 or 3 years of actual knowledgeable experience now, because, and as you see, right, as I'm doing all this, working on my book, I'm still dissolving and reorganizing all of this stuff, it's still specific to the subcategorical quirks of my dilemma, but I'm also going into other categories that don't even affect me at all, like the psychosis and schizophrenia and stuff. I'm not getting super deep into those because, again, I haven't experienced that for real. I can only imagine, make up this fake image in my head what that could be like in someone's mind, or, and I mean, I guess the closest thing to like a schizophrenic or psychotic episode I'd ever had was really dissociate. Very dissociate. And maybe a quirk of some, some borderline and bipolarism mixing in. And again, my multiple personalities, I'm always, trying to act normal in front of people, or used to anyway. Now I don't do that so much anymore. Now I'm like, I've worked hard to become a decent person and even pleasant to be around. If I have some quirks, deal with it, or go away. Or tell me to go away. Don't sit there and hate me for it. And if there's something annoying that I might work on, let me know. So I don't go to any extremes at all anymore to, unless I'm in a public place that is different than private play, But yeah, and I've even had to excuse myself from situations because, again, that's the knowledge and experience. I'd be like, oh man, that's just, the emotions are too intense. I can sit here and scream and yell all I want, but that's only going to get me a worse standing with this individual that or group of individuals that I'm screaming and yelling at, in my head, and sometimes ends up out my mouth. And so I'm like, I gotta go. And I do. I just gone. Just disappear, go home, pace the floor, put some loud music on or something, just whatever I can. So I'm not sitting there obsessed with emotional outrage. Or is it, I should say, obsessed by the emotional outrage, not with it. I was obsessed with it. Now that I understand what it is, now I just get obsessed with not causing any collateral damage, not causing any long-term relationship problems that I can't straighten out. And at this point, if I can't straighten a relationship problem out, it's your fault, not mine. Let's see. So let's we've been talking about the high and euphoria, and now you're understanding. The high and euphoria isn't dopamine like drugs do for most people. It's an actual personality moral high. And not that I'm living on the moral high ground, so to speak, even though according to the Bible, I am. But again, it should be a contest or a competition, but I don't think it is. But when I say moral high ground, I'm talking about when I feel innocent. Not morally innocent, but actually legitimately innocent. Like, no, it's not quite the way to put it. This is tough. Okay. Let's try another video here.